Good morning, everyone. And first, thanks to ARDSI Pune, and Chaitanya for the very kind invitation to be here today. My topic is technology in the management and care of a person with dementia. And it's always nice to be asked to do something because that makes you put in some effort to put information together, which is what I've done for this topic. Now, in 2012, I was one of the global chairs of the World Health Report on dementia, and I actually edited the whole segment on caregiving. And what were we saying in 2012? We talked about telephones and video phones for counseling and support services. We talked about video-based psychoeducation interventions for improvement in mental health, and we started talking about social media platforms. This is what we were preoccupied with in 2012. And what did we say about assistive technologies? We said that they could improve safety, economy, support people, improve their quality of life, give peace of mind to caregivers, and we need more research to evaluate them. This World Health Report is available for you to download and read, free to web. Now, what's happened subsequently? We are now talking about Amazon, Alexa, Google Home Hub. We're talking about robots. We are talking about virtual reality, artificial intelligence, and autonomous driverless vehicles. So, technology has changed. Dementia has not. Caregiving has not. But technology is changing very rapidly, and technology is giving us an opportunity. And I think that we need to embrace that opportunity. How many people in this room are under 35 years of age, please? Hands up. I see quite a few hands up. How many people in this room are over 50 years of age? Hands up, please. Okay. Now, so this comes with a disclaimer and a warning. If you're over 50 years of age, you'll think all this is not possible, it's not going to happen. Okay. If you're under 35, you're going to be interested. And the challenge for the people who are younger is that the decision makers are people like me, older and slow to adapt and not willing to think. Okay, so that's another challenge that we'll all have to accommodate. But technology is exciting, and let me tell you why. Okay, so we are actually looking today for people with dementia at complex smart home systems to the fourth generation of human-like social and service robots. Now you'll say, oh, this will happen in Japan, this will happen in the US. It's not going to happen in India. It's certainly not going to happen to the ordinary person in India, right? I'm recording my talk as we speak, and my team's kitted me out to carry a kit that does its own recording. This is happening in India. There's a lot of things that are happening because as technology generalizes, technology becomes cheaper. And if you bought a car 10 years ago and you bought a car today, you will notice how much difference. You bought a two-wheeler 10 years ago, you bought a two-wheeler today, you'll notice how much difference there is. So technology is rapidly growing, technology is adaptable. The faster technology generalizes itself, the cheaper it becomes. And this is something that all of us need to wake up to as well. A few slides I borrowed from my good friend and colleague from Singapore, Dr. Kandaya. Dr. Kandaya is working at the cutting edge of how do you use technology actively, digital technology actively. The point we need to understand, therefore, is we start with normal aging. We go through a phase of subjective cognitive impairment. We go through a phase of MCI. Then finally, we end up with dementia. And therefore, the pathology, there is a preclinical and mild cognitive impairment, there's mild dementia, and then there's moderate to severe dementia. The earliest phases are at least 10, 15, 20 years before you become symptomatic. Most of us start walking when we are in our 40s and become aware that we need to walk. Yesterday, someone was saying we should do 8,000 steps. Actually, the cerebrovascular and cardiovascular recommendation today is 10,000. It's being revised to 15,000 steps a day. Okay? So most of us start doing these things by the time the damage has already happened, right? So we're doing what we can. So you need to start walking or you need to start exercising much earlier. And this is something that you need to keep in mind. But there is an opportunity here also to think about what we've been talking in this conference. It's not just cognition that we ought to be concerned about. There are behavioral red flags. as Dr. Matthew was just talking about. And there are physical red flags. I don't know if you notice how many of us, as we get older, walk slower. We walk more cautiously. We hold on to rails when we go down steps. Those are the physical accompaniments of neurodegeneration, and they are also hallmarks of possible dementia. Important to keep this in mind. And then, of course, if you think about it, there are a very large number today of digital diagnostic tests. A very large number of clinical trials today for dementia are run by cognitive tests that are administered digitally. Okay, so it's possible. I use in my practice very extensively. So I have from autism to Alzheimer's, I have patients. My youngest patient is 1 month old with neurodevelopmental disability. My oldest patient is well into their 90s. Okay, I use cognitive tests, which are digital online tests to evaluate people. And it's possible to do. I bought a subscription with a US platform. I charge a pretty penny to do this, right? But if the Indian government put that into the ICMR toolbox, then all of us could start using a digital diagnostic test. So it's not about whether we should pay. The question always in public health is who should pay, right? And for something to be democratized, you shouldn't have to pay as a citizen. I think that's the point that you need to keep in mind. And then, of course, what has happened is that smartwatches. Now, how many of you are wearing a smartwatch? Hands up, please. So, how many of you know how many steps you walked yesterday? How many of you are tracking your goals? So, the whole point, the bottom line, you can do it on your phone as well. The bottom line, therefore, what if your wearable tracked those 9 things that they've been talking about from the Lancet paper, which are relevant for cognition, which are relevant for dementia? It's possible today, right? For example, my Apple Watch tells me, oh, walk 1 more minute and you would have done you'll meet your goals today. So when I park my car at night after clinic, I will go walk that 1 minute round my flat and then go in because it told me. If it had not told me, I wouldn't do it. It's as simple as that. Wearable technology, therefore, allows you to track what you do. And this is extremely important too. And therefore, today we have another exciting development, gamification, right? You can actually use games not just to diagnose, you can use games to treat. Cognitive retraining, cognitive rehabilitation. What is our limitation in practice? Our limitation is having a trained person available everywhere and that many number of trained man hours. That is our limitation. If I had games available on cloud, I had a trained operator, the sky is the limit. Anyone who's got access to a digital environment can do it. And today, tell me, how many elders are on WhatsApp? How many elders are on Facebook? How many elders are busy commenting to each other about everything that happened? It's a growing number. So when people tell me, oh, this is not possible in India, I say, please wake up. Look at your grandmother. She's probably more proficient on WhatsApp than you are. And this is something to keep in mind as well. So your ecosystem is developing. The ecosystem is community-based users, primary care users, and tertiary care users. It includes digital diagnostics. You can digitize existing tests. You can gamify new tests. And then there's digital therapeutics, which can include psychoeducation, digital exercises, cognitive games, behavioral activities, and a digital diet. All of this is possible. All of this is already happening. Please remember, if I can't read or write today, what do I do? What does your buy at home do if she's not coming today? She sends you a voice message. Sir, not coming today. Right? So she can't type it in, but she'll send you a voice message. So adaptability is possible, and you can concierge people through these things. So I have a team that gives them a digital test and then concierges them with the digital test, tells them how to go through the test. That's all they need. They need a little bit of help, and once you give them a little bit of help, they're perfectly all right. They can do it, and it's exciting. Now, what's happening in China? Thanks to ASI's new gen drug, which is the third one that's coming out among all the exciting new drugs, dementia care is getting democratized. They've created an entire online platform. This is between government, administration, caregiving centers, and insurance. The company ASA is involved. There are digital internet hospitals for dementia. People are trained, people are taking online tests, people are being tracked, and this is happening live. Now, why is ASA interested in funding this? Anyone? I'm making the drug, I want people to use it, right? So I first need to find out who will use the drug, right? I have no problem paying for an online platform if I can identify the 50,000 people who are going to pay and take this drug. It's very, very simple. It's as easy as that. It's just market economics. And we need to learn to play to that. And therefore, it's possible to have, if China can do it, India can do it. Atmanirbhar Bharat. We need to develop our own platform, right? So the future, as Dr. Matthew was telling us, Professor Matthew was telling us, are non-pharmacological treatments, not just drugs. But here is what you need to understand about non-pharmacological treatments. They have some advantages. They are person-centered. They are culturally salient. And they meet three of A barriers in healthcare: availability, accessibility, and acceptability. They meet those barriers when they are present. What are the disadvantages? They are time consuming, they are expensive, they are difficult to scale and replicate, because most non-pharmacological treatments involve a specialist in a room with either one or a few people with who are affected by dementia. They have soft but not hard proof. Cochrane will not accept them, but I say, damn Cochrane. Who's interested in Cochrane? Beyond the point. And they do not meet the affordability and accountability targets always. How can you prove that a massage helped you? You can't prove that a massage helped you. How can you prove that having lavender helped you? You can't prove that lavender helped you. But the point is that there is a general wisdom that these things can be helpful, which is what Professor Matthew was presenting. Until now, we were told, oh, there's no proof that these make any impact. It's only the drug that makes impact. Now, here's proof in nature research that non-pharmacological therapies actually influence brain activity. And this is something that you have to keep in mind. I do something for many of my patients, which is an Ayurvedic procedure called a Shiro Abhyangam, which is a head and neck massage with medicated oil done 3 times a week for 5 weeks. Universally, both my children with autism and my elders with Alzheimer's disease calm down, sleep better. You heard what are the 3 problems? Agitated mood, sleep, and digestion. All 3 will improve with just doing natural treatments. Take my guarantee for it. I've done it for over 15,000 people. But the point is, so how do they work? If you ask the Ayurvedic doctor, he will tell you that's because the medicated oil penetrates into your brain, it's influencing through all the good properties that it has. His explanation is not one that is acceptable to us. How does it work? Probably because it changes the metabolism in your brain. What happens when somebody massages your head for 60 minutes? There is an impact on the metabolism. And Madhav Tambisetti, whom Professor Matthew knows just as well as I do, is someone who has demonstrated from Johns Hopkins that a metabolism gene is involved in Alzheimer's disease. So what are you influencing? You're probably influencing metabolism. It's the explanation that is wrong. But that it has impact is definitely there. Okay. So current drugs that we have, what do? They only marginally effective, and even the new ones like lecanemab, what do? They wipe out the amyloid. Fine. Is it giving you impairment clinically after 1 year? The answer is no. We don't have proof that there is clinical improvement when you take these drugs. There is biological improvement, which means that we don't want to use psychotropic agents for all the reasons that Professor Matthew was just outlining. And therefore, non-drug client-centered interventions are useful. Now, we were preoccupied largely until now with things like Tai Chi, things like yoga, things like reminiscence therapy, things like activity scheduling, and so on. Today, we have new neurotechnologies, which is the next part of my talk, which can actually influence the human brain. And therefore, we have to redefine our goals into activities of daily living being maintained, quality of life being improved, preventing people from needing hospitalization and institutionalization, encouraging family care, caring for the caregivers. All these have to be our revised public health goals, and we need to be working towards those goals. And the evolution of biomarkers or all this modern science that's going to cost you 26 lakhs a year is not going to change any of this. All of this is still required, whether or not you have access to the new drug. And this is something that we need to acknowledge. Now, what are the forms of non-invasive brain stimulation? I can tell you this is the most exciting space that we have today. It's changing day by day. So what we have is repetitive transcranial magnetic stimulation. What we have is transcranial electrical stimulation, which includes direct current, alternate current, and random noise. What we have is transcutaneous auricular vagus nerve stimulation. And what we have is QEEG neurofeedback. These are technologies that we are actively using in Buddhi Clinic. Our counter right now says 15,356 interventions. This was the day I started from Chennai, so we must have done some more yesterday. Now, the point is, what does tDCS do? It's a form of brain stimulation. It's non-invasive, non-focal, non-convulsive. It's a very low current that's passed between an anode and a cathode for 20 minutes. The patient is fully conscious when you're doing it. What does it do? The neurons become more or less likely to fire. It either stimulates or inhibits your brain neurons. It does not trigger action potentials, and it has lasting effects because it has incremental changes over time. So as you give a person, our usual protocol is 4 sittings a week for 5 weeks. As we go through this protocol, we see changes. We see changes in the behavioral score, we see changes in the cognitive score, and very often most of our patients are doing about 30 sessions of this in a cycle. Now, there is plenty of proof with controlled trials showing that tDCS is effective. Now, hyperbaric oxygen therapy and normobaric oxygen therapy is another thing that can be very, very useful for cognitive enhancement. And normobaric oxygen therapy is very easy to do. We all have these portable oxygen machines, concentrators that we bought during the pandemic and we put away somewhere in the corner of our house. Okay? Believe me, 20 minutes of putting yourself on that every day is actually good for your cognition, right? And if you already have one sitting around, provided it works, you're very, very likely to benefit. Okay, so NBOT is very easy to do. HBOT requires equipment. Hyperbaric oxygen therapy requires equipment. Normobaric oxygen therapy is very easy to do. We simply combine it with the tDCS. When they are taking the brain stimulation, they are also breathing in oxygen. We do the same 20 sitting practice in our clinics. Okay, and there is a fair amount of research that shows these approaches have some benefit for human cognition. Now, rTMS, repetitive transcranial magnetic stimulation, has been around a long time, and for many years it was thought of as a placebo. You know what the problem was? The problem was the technology. The magnetic impulse that it was generating was not strong enough to penetrate through the skull. That was the problem. Today we use a 4 Tesla magnet. Your best MRI in India is a 3 Tesla magnet. We use a 4 Tesla magnet to stimulate, and we are able to penetrate. And today we have something else called deep TMS that's come into India. Deep TMS is currently approved only for depression, but that actually penetrates about 4 centimeters into your brain. Okay, so there is a fair amount of technological development that's helping this. It's a painless, non-invasive technique. It does not require any anesthesia or sedation, and many applications have been developed over the years. Most recently, this paper was published where stimulating the precuneus helps cognition in Alzheimer's disease. And therefore, rTMS as a solution for dementia is today very much on. Okay. Patients with higher education and patients with mild to moderate Alzheimer's disease were more likely to benefit from rTMS than patients with lower education or with severe dementia, respectively. So this is another technology which is available. It's expensive technology. The cheapest machines are about 17 to 20 lakhs, but it is extremely versatile and can be used for a range of conditions. Now, vagus nerve stimulation was first propagated for seizure control with implanted vagus nerve stimulators. And I remember as a clinical fellow in the UK, this trial was going on then. Subsequently, it became a treatment for depression. Over time, vagus nerve stimulation, the invasive version, actually has gone out of vogue, and we don't do many VNS surgeries anymore in India. Although it's a relatively simple surgery where you put a stimulator under the chest wall and connect it to the vagus nerve in the neck. But what happened in 2017, 2018 was that Sotrix, an American company, brought out a transcutaneous auricular vagus nerve stimulator. And this is, you are stimulating the pacing, the auricular branch of the vagus nerve. Originally, the conditions for which this was proposed were epilepsy and migraine. But one thing that we have found post-pandemic with the long COVID symptoms, it actually is very, very useful when patients have clinical autonomic dysfunction. And the vast majority of people with long COVID symptoms actually have clinical autonomic dysfunction. And if you evaluate the large number of people who come to clinics saying that they have what we end up calling psychosomatic symptoms, they will have clinical autonomic dysfunction. So it's a very, very useful and interesting technique. And dead giveaways for these patients are what is called POTS, postural orthostatic tachycardia syndrome. When you take the pulse and the BP lying and standing, the pulse races up by more than 30 minutes. And that's called postural orthostatic tachycardia syndrome. And the BP falls systolic by at least 20, diastolic by at least 10. Then you are POTS positive. That's a giveaway. It's useful also in our patients with dementia who have gut health issues. It's useful also in our patients with dementia, our patients with autism who have gut health issues. And to me, there are remarkable commonalities between these conditions, one that's developmental and one that is neurodegenerative. So vagus nerve today is coming in two ways. One is as a cognitive enhancer in Alzheimer's disease, emerging evidence. Another, very, very interestingly, in the acute treatment of strokes. Vagus nerve stimulation is starting to be used in the US in acute stroke units when the person has just presented with a stroke. It helps to reduce disability. Now, neurofeedback, again, has been around a long time, but the technology is getting better and better. And basically, it helps you to monitor and self-regulate your brain activity and has shown great promise in addressing cognitive impairment and dementia. We use this extensively, less so in our adults and elders, much, much more so in our children and working professionals. The reason is because elders take some time to adapt to technology. They do much, much better with human interactions. They prefer to have the therapist doing cognitive retraining, reminiscence therapy with them rather than actually use technology. But we have some elders who prefer technology. So this is something else that we are using extensively. Now, this is how we work in Buddhi Clinic. We have Ayurveda, we have yoga therapy, we have naturopathy, we have acupuncture, reflexology. We have a physical and occupational therapy. We prescribe medication. We have a whole house of neurotechnology and neuromodulation. And we have a whole mental health team that provides psychological therapy. We are all working together under one roof. If somebody walks in, whoever they are, we do a team assessment and we use outcome measures to score their symptoms. We then give them a care plan. We execute that care plan as we said that we would, and we track their outcomes, middle of therapy, end of therapy, each cycle. So if you take, for example, an Addenbrook's cognitive examination score, it's available at baseline, it's available at middle of therapy, it's available at end of therapy, and we're able to track progress. And for this, we have an electronic medical record. We've also invested heavily in an ERP system, which is built on the Zoho One platform. And what that helps us do is it's got something called customer relationship management. So we know who's doing what, where they are. We have something called people, which is our people who are working with the customers and who each person is working with. We have something called bookings, which is a whole scheduling platform, and we have something called books, which is the accounting platform. And all these are interlinked. So the dashboard, if I say, for example, that I'm the patient, Dr. Krishnamurthy is the patient, it will show the entire journey, where I am in my journey with regard to each one of these things. And it makes life remarkably simple. We've also got a whole range of checklists that we built in, so that at every stage, we actually have checklists that people have to complete. And this is the way in which we've learned to work this program. We, across 4 units, we are 60 people today, and we work with approximately 350 to 400 clients at any point in time. And so it's a very active program that we run. So what can you integrate when it comes to asking yourself that question? It's possible to integrate a whole range of non-pharmacological healing systems, including culturally acceptable and available local traditions. This is very, very important to remember. And why are culturally acceptable traditions important? Patients, people in general, accept them much, much better. Many of my older patients, can I stimulate your brain? Oh, no, doc, all that I don't want. Will you do Ayurveda? Super, doc, damn good. Thanks so much. Now, the point is, it's a belief system. So rather than say, no, no, you must do this, I'm offering them a healthcare marketplace. I call Buddhi Clinic the McDonald's of healthcare. You can come in, you can say, I want to have only fries. You can say, I want to have a meal. Or you can say, curate a meal for me. But the bottom line is that we have many things on offer. At this point in time, 17 different treatments on offer that people can choose from. But it is guided choice, and we help them make those choices. This is extremely important, according to me. It's very important for us to build seamless models of care. There is no point in living in silos and creating models of care that are exclusionary and saying that only this works and nothing else works. That doesn't help at all. Everything has a role to play. We need to know the best ways of synthesizing the best things that we have available. We can bring together. My mission is to prove that you can bring together the best of modern science and the wisdom of ancient healthcare traditions. You can blend them together. Who said you can't? It is eminently possible. And I take pride in the fact that people can go to one floor in my clinic, have their brain stimulated, go to another floor, do a yoga session, go to a third floor, have a chat with the psychologist, and leave all on the same day. And I think that that's how we need to think about chronic disease management. It's not either or. It is the ones that I need and how I engage with those things. And most importantly, we need to be able to track your outcome in healthcare. That's extremely important. So the qualities of integrative health practice are 360-degree assessment and diagnosis. We need to be able to track and monitor outcomes. And if you look at technology, technology provides you a huge opportunity to do all this on the go, and also remotely. So, for example, what we are building now, we have a hard copy word book. It's already organized so that they report their progress in therapy. Now, what we are doing is digitizing it and converting it into an app. And our intent is to give the parent or the child, the primary caregiver of the patient, access to that app. So I know that my father went in today and had his session of Ayurveda. I know that my father had a meeting with the doctor today and these were his scores. I know that his blood pressure is being tracked. And I, as a child sitting somewhere else, which is the reality of modern life, is feeling very, very comfortable. So being able to adapt technology is very, very important. Now, here's what we did for one of our patients. It's with Alzheimer's disease. It's an intensive therapy program that includes physiotherapy. He had gait difficulties due to palmar fasciitis, which we took care of. Psychology, mainly cognitive training, retraining, and reminiscence. In him, how we personalized it, he loves old Hindi movies and old Hindi music. So we use that. He collects watches and calligraphs. So we use that. And we use that to work with him in cognitive retraining. We gave him sessions of tDCS and normobaric oxygen, 30 sessions actually, each year for 2 years. And he has been regularly on our holistic care program. We've used things like acupressure, reflexology, chanting and prayer, and he's a very spiritual and religious person. So we use chanting and prayer and yogasanas. We managed to improve his score, ACE score, from 62 to 73, and we maintained it for 24 months until he got influenza and got really badly hit. And unfortunately for him, that was the step down. He's not recovered from there. So 73% of our patients have shown an improvement in their MMSE scores at 8 weeks interval. This is sample data from our own team. Very interestingly, our integrative medicine alone group improved its ACE scores, and our integrative medicine plus tDCS group also improved its ACE scores. They both improved significantly. The interesting thing is the baseline ACE score was lower in our integrative medicine group than it was in the integrative medicine plus tDCS group. So we've got probably a selection bias when we are prescribing tDCS. That's quite possible. We are looking at people with early cognitive impairment or not so far gone when we are prescribing tDCS. And very interestingly, if you see, many of the behaviors in the neuropsychiatric inventory improved significantly at the end of each of our programs. And this is collective data across patients, again at 8 weeks interval. So combining modern tech with ancient treatments is helpful. A multidisciplinary team is really useful. Being process driven and rigorous is extremely important. We take therapy home. Many of our patients cannot come to clinic, so about 30% of our patients are actually treated at home, at their doorstep. And we do regular assessments to track their progress. And I believe that this is extremely important if you want to develop a program, including one that uses technology. So we encourage harmony in medical care. Traditional systems and modern science must come together to help people enhance their human potential. And I think that's the whole purpose of why all of us are here. So please embrace technology, is what I will say. And please don't forget your very, very rich heritage of Ayurveda and yoga. It's gold, it's magic, it's got the power to change the world. Thank you so much.